May is Melanoma Awareness Month. My name is Trevan Fischer. I'm a surgical oncologist here at St. John's Cancer Institute. Skin cancer is one of the most common cancers that we see. Melanoma, however, is only 1% of those diagnoses, as the more common diagnoses are basal cell cancers and squamous cancers. Melanoma, however, though, is a deadly cancer if not caught early. So the American Cancer Society predicts that in 2023, almost 100,000 people will be diagnosed with melanoma, with about 10,000 deaths to that. Due to increasingly effective therapies, the rate of death for melanoma is decreasing across all age groups, but the incidence, especially in younger patients, is rising. There are many different signs and symptoms of melanoma. Most people notice a mole that is changing in color, has asymmetric borders. One part of the mole looks different than the other part, or is changing over time and bigger than 6 millimeters. We call these the ABCDEs of melanoma. That's asymmetry, so a mole that has an asymmetrical border. Border irregularity, the edges of the border may be fuzzy or look different from the other side. Color variation, so one part of the mole may be a different color, or there may be a darker center or part of the mole. D is for diameter, so 6 millimeters or about the size of a pencil eraser. Moles that evolve, that's E, over time. And so most I tell patients to look for sort of an ugly duckling, a mole that doesn't look like the rest of their mole, or any mole that's changing. If we use these in our clinical practice to find out which mole should be biopsied, we can reduce the risk of melanoma having spread by diagnosing it earlier. Melanoma can be cured if it's caught in an early state, and with greater advances in our systemic therapy, we can actually now cure patients with advanced or metastatic disease. Some of these therapies include immune therapy drugs or immuno-oncology, and these are drugs that help our body's immune system go and fight the cancer cells. And there are other drugs called targeted therapies, in which about 50% of melanoma patients have a mutation where these drugs can target that mutation and have great results. Patients should be getting screened about once a year if they've never had a melanoma diagnosis themselves. And there are several things that we can do to reduce the risk of melanoma. Number one thing to do is to avoid getting sunburns. Sunburns are the worst thing you can do, especially if you're already at an elevated risk. Some of those patients who are already at an elevated risk are those with fair skin complexion, red or blonde hair, blue eyes, and those who burn easily. Patients with these characteristics should really pay attention to how much sun they get, and importantly, how much sun they get early on in their first 2 decades of life. All people should avoid tanning beds. Tanning beds, we think, have been one of the causes that more younger women are now being diagnosed with melanoma. About 10 or 15 years ago, probably the common age of being diagnosed with melanoma was around 65. And now we're seeing this at a younger age. In fact, women in their 30s and 40s now are presenting now with melanoma. So avoiding tanning beds are a must, especially if you're at an increased risk. You can get melanoma where the sun doesn't shine, and so it's important to also have your dermatologist or your primary care doctor look at those areas as well. Once a mole has been biopsied, it usually takes about a week or so for pathology to come back, and if there's any abnormal or atypical cells, usually the dermatologist will then refer you on to a surgeon to deal with the lesion. Surgery usually depends on where it's at, but surgery usually includes what's called a wide local excision, where we remove the mole with a normal rim of tissue around it, and then testing the lymph nodes if the characteristics are high enough where the lymph node involvement is significant. This is mostly done as an outpatient surgery. Patients go home typically on the same day and typically recover very quickly from that. From that surgery, we learn if the lymph nodes are involved, there may be some more workup that's involved, but if we can catch melanoma at an early stage, stage 1 or 2, 5-year survivals are as high as 99%. And so it just goes to show that early detection, as with most cancers, is key. So if you have any questions about this, as we should all be thinking about our skin during the month of May for May Melanoma Awareness Month, please don't hesitate to reach out to us. There's a multidisciplinary group of providers here that take care of melanoma patients. From early surgical stages to more advanced stages, we have a whole host of cancer support services that we utilize our patients to use, and we'd be happy to help any way we can.